I don't support that.
It's more likely for you to commit a crime.
If you gotta take a quick pause to get yourself together.
No, I'm just forgetting like everything I'm like saying.
How can you say that they need to be treated with respect and then also say that their natural instinct is disordered?
Trump was just sworn in as the next president of the United States.
Hello and welcome to the first episode of Season 2 of the Take 2 podcast. We're in a new recording studio, so we can't wait to get started. It's a little bit hot in here. It's not temperature controlled. We're still figuring some stuff out. Like lighting we're going to fix. I think we're going to put some more cool stuff back here. But yeah, it's exciting. We're open to feedback and we're going to get it looking as awesome as we can.
Like Tom said, I'm super excited to get back into the podcast. Today we're joined by Ronnie Decker. We're going to be talking about American healthcare and systemic racism in America.
With that, let's look into the news stories for today. As we all know, conservative commentator Charlie Kirk was shot and killed at an event on the 10th at Utah Valley University. Weeks after the event, we are starting to learn more about the suspect.
Yeah, the suspect was 22 years old from Utah. His name is Tyler Robinson, and he's being charged with aggravated murder. As of September 16th, we know that he's a member of the Church of Latter-day Saints, widely referred to as the Mormon Church. State records show that Robinson is registered to vote, but he's not affiliated with any political party, and is listed as inactive, meaning he didn't vote in the most recent elections. He seemed to have planned the murder up to a week beforehand. Information is from the Associated Press.
We'll now go into the debate segment. Once again, today our guest is Ronnie Decker. Ronnie, would you like to introduce yourself?
Yeah, hi guys, I'm Ronnie. I'm a right of center political views, but most of my takes come from my faith in Catholicism.
All right, thank you. Today there will be 2 debate topics. We will spend 20 minutes on each topic. I will act as a moderator for the first debate, and Gabe will act as a moderator for the second debate. The moderator will give a 2-minute warning, and this debate will be open discussion and open note. To start, Ronnie, you can state your claim.
Sweet. All right, so my claim is that the privatization of healthcare in America works as a better system than a publicly funded system would.
For sure. So let's start by talking about the key differences between public and private healthcare. So publicly funded healthcare means that you're taxing your citizens and you're using it to fund your healthcare. Privately funded means it's in the hands of corporations. So first, I kind of want to talk about why you believe, because at a blanket value, it seems to me, publicly funded healthcare is just inarguably better than private, because publicly funded healthcare is fair and privately funded healthcare is not. So as someone whose beliefs come from faith, I'm curious how you view that dynamic.
Yeah, so in my opinion that it's a little bit safer. So I've heard stories of some of my parents' friends who live in Canada. Canada, for those who don't know, is a publicly funded healthcare system, and they've had to wait years for some treatments like cancer treatments or non-emergency procedures. So wait times are longer. The difference between kind of like the money spent, I'm just going to use Canada as an example here. There are lower costs. America spends about 17% of its GDP on healthcare, while Canada spends around 11%. But this also leaves a country like Canada rationing some of their care. So American people are able to get some newer tech or newer medications. Well, sometimes in Canada, since they're rationing out their money, trying to save money where they can so they can get everybody care, they're losing some of those higher tech medications and services.
I want to talk about that second thing in a second, but the first thing you said is that wait times are shorter with privately funded healthcare. That's actually a very common fallacy. That's not true. The wait times in publicly funded nations are consistently reported to be the same, if not better, than the US. And the reason that data on this is so skewed is that of developed countries, the US is the only one that doesn't have publicly funded healthcare. And it's also dead last in healthcare, in everything, like life expectancy, medication, tech. They're dead last. Like European countries, the UK has better medicine, has better technology because they're publicly funded, and they can. And there are, I agree that some people would have to wait longer in Canada, but that stems because there's a system to rank the urgency of problems, and in the U.S., the urgency isn't how severe the problem is; it's how much money you can pay.
Do you have a source for that?
Yeah, all my stuff in terms of U.S. information is coming from the American National Library of Medicine.gov.
Because I had like some sources from America and beyond that were saying other things, but maybe my stuff is out of date.
The key thing is that for like emergency treatments like cancer, urgent treatments, wait times are not longer. Urgent treatments, wait times are not longer. Routine checkups, other stuff like that, I didn't do research on.
Sorry, so you're saying emergency care like cancer and other stuff like that is shorter and publicly traded?
It's the same wait time, if not shorter, according to the National Library of Medicine.gov.
Okay. And then you wanted to talk about the...
Yeah, so the tech part, that kind of stems into how universal coverage is too expensive, which is another thing that is regularly brought up when it comes to publicly funded healthcare. But again, according to the National Library of Medicine.gov, studies show that universal public healthcare would save Americans, like the citizens, hundreds of billions annually, and put that money into take that money. So the money, I'm sorry, I'm stuttering.
You're good.
So you're saving Americans hundreds of billions of dollars. And, hold on, let me look over my notes for 1 second. Cost the world's highest. Yeah, no. So the U.S., can I just ask again, what did you say about the technology?
Yeah, so I have from the, sorry, trying to find my source here. The Affordable Care, no, wrong. Shoot, I just lost it. But I have that tech is better in countries like America because of their spending, while countries like...
What do you mean by tech? Like
service, so like MRI machines,
for sure,
or X-rays, stuff like that, and also different kinds of medications.
The medications in other countries and in the U.S. and like the types of machines are largely
I'm saying
same.
Like they're developed quicker in America and they're more. Like,
okay.
The access is sooner.
I could see that.
Yeah.
But you know, America also pays we pay a lot more.
We spend 17% of our GDP on healthcare. Well, I'm using Canada as an example. I said they spend 11.
Okay. So that kind of, we can talk about that if we think it's better to put the money into getting the tech sooner, or if spending more of your GDP on it is more important. Do you want to take the conversation there, or do you want to pivot it to more? Yeah, for sure. Another thing, I want to talk about one of the reasons I think publicly funded healthcare is so important. Routine, like everything is covered under publicly funded healthcare. Yeah. Routine checkups, like you go to the doctor, it's free. And that is like not in America. And again, kind of like Jesus's teachings and everything that goes with that.
I just kind of would like to stay off the religious topic with this. Just stay kind of on the right track, you know.
Okay.
We could get down a real big theology loophole with that. And
okay. So where do you want to go with it then?
So I'll just wanted to answer one of the points that you brought up. So how America is one of the lower ranking countries in terms of care. I have down from the American Action Forum that hospitals in the U.S. have some of the highest survival rates for more complex conditions, especially cancer. We have one of the highest survival rates, while countries like Canada and the UK have been known to have lower survival rates for those.
But those conditions are less common. Like, what does it matter if you're going to get a complex cancer treatment if when you break your arm, you can't pay for it? You're gonna, like there are other things that need to be taken care of that aren't just terminal illnesses. Like if a homeless person is on the street and they break their leg, what are they supposed to do about it in America?
Well, there's acts in place like or Medicaid, the Affordable Care Act. Also
But Medicaid only goes so far. Medicaid goes directly to treat the bone, directly to treat it. What about the stuff that comes after that? What about like all the additional needs that come after that? It's not covered by Medicare.
Well, it's not, but it's also, if you have a privatized health insurance, like I'll give an example. My neighbor, he broke his knee when he was 7 years old or something like that, and it was covered under his grandpa's insurance, who had a job and was a contributing member to the economy, and his insurance paid for nearly all of the coverage. Obviously, some of it's coming.
His insurance. What about, like, what if you don't have your grandfather's insurance?
It is like, it's encouraging people to get jobs and go out and get a job.
But insurance, whether or not you have the right to be healthy and live comfortably, like not even like live comfortably in a house, just be comfortable, should not be tied to if you have a job. Mm-hmm. Like this will go back into the whole loop. Homeless people can't get jobs. Like they sit on the street, people won't hire them because they can't shower, they can't like give a resume, they don't have clean clothes. So now you're attaching insurance to a job, which is another thing I would like to talk about. How publicly funded insurance allows the economy to flourish more because, the individuals to flourish more in an economy because they don't have to fear losing their job as severely. Because losing a job means losing your insurance. Mm-hmm. And losing your insurance can mean dying in America. So it's kind of...
Yeah. Well, there's obviously trade-offs. Like, it's going to be harder for people like that to get their care. And obviously, no system is perfect. Like, I even have here, America's system, it's not perfect. But
for sure.
No system is. Like, it's like a zero-sum argument.
But what we're talking about is what's better. And so to end this on a middle ground, we need to say, like, not on a middle ground. To end this, like, just end this, we need to say, why is private better? Private, you can't say it's better because in the minuscule amount of cases where, like, you have some super complicated terminal cancer, then you have a higher chance of surviving. That doesn't make it better for the hundreds of millions of people that are living in the country who can't afford healthcare. I have the stat in here somewhere. There's a gross amount of people who don't have healthcare in this country.
I'll give you the time to find it.
Yeah. Over 28 million uninsured in this country. Yeah. And in countries, this is from 2021, so this stat's a little older, but, and I actually do have that written down as well, that in 2021, U.S. healthcare cost was 20% of the GDP, and in Canada it was 13. So, per capita, the U.S. spends, hold on.
Well, they're going to spend more.
Yeah, they spend more.
Based on
yeah. And then
70%.
the 70%, and then
Population's higher.
Yeah, but the outcome of that is that Americans have shorter lifespans.
Well, that can be correlated to different things, like the higher obesity rate in America. We're one of the most obese countries in the nation.
For sure.
Yeah, there's different diseases too that we do better at than others, and we already went down that. But yeah, I don't think it's necessarily correct to use that the life expectancy here is lower just because there's outside factors.
Yeah.
It's correlation, not causation.
For sure. But 28 million uninsured. And those other countries have virtually zero, like Canada, UK, France, Germany, virtually zero uninsured. So it is a lot of people uninsured. And on top of that, a lot of people, the number one cause of individual bankruptcy in the U.S. is medical bills that you can't pay. So it is not like it's only the homeless people. It's not. It's a big problem in this country, and it's not a problem in other developed nations.
Then you can't say it's not a problem.
Not like this. There's not 28 million people who can't have insurance.
Well, you're telling me a country in Canada where there's kids who are having to wait months upon months to get care.
They also have to wait months upon months here.
Yeah, but they're waiting forever to get the care that they need.
They also wait for the same time for severe illnesses. You're saying that the U.S. does severe illnesses better, sure. But if you can wait the same amount of time for an illness, like the time is the same. The U.S. is treating a severe illness better, but you're paying an extraordinary amount and it's putting you in a crippling debt and bankruptcy. Which situation would you rather be in?
So you're saying, would I rather have to wait longer and risk?
You don't have to wait longer though, because we're talking about these terminal.
Well, there's stories too of like people coming to the U.S.
There's
from Canada
stories
to
of
get care.
everything.
'Cause
There's
they-
stories
they have
of-
to- that they've waited years upon years to receive in other countries. And
There's
they come
stories of people
here.
moving to Canada because of the free healthcare. Like, there's stories of everything. What we're talking about is facts, like factual information. And the factual information is that people are uninsured and dying in this country because they can't afford healthcare. And it's not happening anywhere else. So it's, in my eyes, not a better system.
Yeah, well, I do see where you are coming from there, but there's people at work trying to make the system better. Like
For sure.
the thing that I have, like one of the points that I have too is that with there's competition within like the system, so there's companies like competing for their customers. So I'll use a hypothetical like Aurora versus
Can I stop you? Competing for their customers, not their patients?
interchangeable. But it's
those
not-
words
it is-
should not be
It is-
interchangeable.
It is a customer because it's the customer and they're trying to provide the better service for like doctors or
But they're trying to provide the better service so they can get more money, not so that they can care for the patient better.
well, if their care is better, then they receive more customers. That's like supply and demand. Like if your product is better, we'll say product. Like
Yeah,
insurance-
your
insurance system
health.
is better.
Yeah.
Like you're able to provide better care, more open, like opening up your system, stuff like that. Then you'll have more patients or more people come to you, more consumers. That way they're getting better care and they're also coming to make you money.
Yeah, make you
So
money. They're
so-
not coming. So are you saying that patients come to doctors
No,
not
no.
to get healthy,
I'm
but
saying-
to make the
no,
doctors
I'm
money?
Saying that, I'm saying that the insurance company wants to make their care either better or like there's a bunch of different factors. They want to make it better or provide the same care for cheaper so that they can bring in more customers. Those customers are going there for their health. Does that make
Yes,
sense?
but
I'm not
no.
explaining it very well, but-
I understand. The problem with that argument, every time I hear it, is that the customer's going there for their health, and their health is getting overlooked for what they can pay.
Well, it's not. No, it's.
Yes,
they're
literally
trying to
yes.
They're trying to make their care better, not necessarily, not just because it's for the people, but it's because if their product is better, then they'll have more people come, right? Does that?
Yes, obviously, but the problem is that that's not happening. Because
It is though. There's competition between these companies.
but the competition between the companies is driven by greed. People aren't getting healthier.
It is, but they are getting healthier.
They're not.
They're-
People health is on a decline, bro. We're not getting. You just said that obesity in this country is higher than anywhere else.
Well,
We're
that's
clearly not a
healthcare.
healthy country.
That's not a healthcare thing. That's a like.
It could be obese people in other countries have more access to medications, surgeries, methods to get not obese. There's therapies that are covered by publicly funded insurance that help you lose weight for free if you are obese in Canada, in the UK. We have an obesity problem here. How's that not a healthcare problem? Because we have food. They have McDonald's in the UK too, bro.
But it's. I'm trying to like think about how to attack this. It's like. I don't really know what to say, but like we're more unhealthy than other countries.
I agree.
Our obesity, our disease rate.
I agree. And we're last in healthcare. You don't think there's a...
What is the last in healthcare entail? Like.
Okay,
Our-
so
our, like,
do you want me to actually pull up the article on my phone
well,
and
I'm
read
saying,
it to you?
there's.
So of
obesity
developed
on-
nations-
well, just give me. One
Yeah,
second,
my
please.
bad.
Like you're saying, last in healthcare is that like our healthcare is the worst, or our like we're providing it to the least amount of people, the least percentage.
That's actually
it's
a
the most
good question.
expensive?
Let me
'Cause
find it.
last could mean a lot of things.
Yeah, let me find it. Oh, it's with the most amount of people uninsured.
So.
I'm sorry.
that's-
I don't know why that took
that's
me
what
so
we-
long to grab.
That's what we mean last. is
Yeah.
like-
most
not
amount of
that-
people uninsured.
It's not that our care is the care that the people are getting is the worst.
The
It's
care
most
is, but
expensive.
the care
Just
is the
one-
same. Yeah,
just one
I'm so
second.
sorry.
It's not that last we're saying it means the least amount of people or the least percentage is receiving it, correct? Not that it's the most expensive or that it's or the care that the people are getting is the worst. It's that the amount of people that aren't insured is the worst.
The amount of people that aren't insured are the worst.
So that's what that worst.
But
statement is,
so-
correct?
Yes.
Okay.
But there is more to it, if you
Go
want.
ahead.
Yeah. So, what publicly funded healthcare does is prevent hospitalizations before they occur by keeping the nation healthy with checkups. Like you catch something before it's a problem.
So that's what other countries are doing.
There are just a little bit under 2 minutes remaining.
Okay.
So that's what you're saying is that we aren't doing that.
I'm
We are.
saying we are not doing that.
We're avenging, not preventing.
Absolutely. That's actually a really great way to say it.
Okay, thank you.
Yeah.
So just one thing I'd like to point out there is that it is a problem. Obviously, our system is broken and it needs to be fixed, and there's probably some middle ground between these two sides where maybe a little bit of it is included in tax, which it kind of is with Medicare and Medicaid. Obviously, those two systems aren't perfect either, or you're paying for some broadcast of it, but they're rationing care in different places. I've used Canada as an example for all of this, but they aren't able to. They might be able to like catch diseases quicker, but they're not able to treat them as effective as we are here, because they're not spending as much. They're trying to ration. Does it kind of make sense what I'm trying to say?
You said that, and according to U.S. government officials, other countries are more efficient at treating diseases and illnesses than our country is. According to the National Library of Medicine.gov. Okay, this big chunk of, I have a text for common arguments and rebuttals, and for this one, I just went to U.S. government sites and looked at a lot of stuff, and care isn't necessarily rationed, because in private systems, rationing is just determined by your ability to pay. That's just like capitalist rationing. It's just a different kind of rationing.
On that note, guys, our time is up, so if you want to respond to that, and then we can wrap it up and go to the next debate.
I think he was kind of like making an input.
Sorry, that was not on the microphone, but our time is up. So if you want to keep going, finish that up, and then we'll go on to the next debate.
Yeah, I feel like that was kind of like a good ending.
For sure.
I think
Man,
we
that was
had-
a great
we had a really good
conversation.
talk.
We did. That was awesome.
Thank you.
Okay, great job, guys. We're going to move on to our next topic.
For sure. I'm going to act as a moderator for the second debate. Again, we'll give a 2-minute warning. This debate will also be just an open discussion with open notes. And to start, Thomas will state his claim.
Great. My claim is systemic racism still remains an active force shaping outcomes in the American legal system.
Cool. All right, so I think before we get into it, we should kind of lay it out in simpler terms. So we're talking about systemic racism as an act in like the legal system, right?
Yes, the legal system.
Okay.
There's racism built within the legal system.
Okay. Just I'd like to hear like your like thesis.
Yeah, basically. So I want to attack this in two ways.
Okay.
So first, I'm going to show like that there is racism present in the legal system.
Okay.
And then I'm going to prove why it's systemic.
Okay.
So like we can just start right away if you're okay. Perfect. So first we'll start with policing. So part of the legal system. Black drivers are 20% more likely to be stopped and searched. Yet contraband is found less often in searches than of white drivers. So we'll start with that. I want your opinions on that.
Yeah. So I had like kind of like Gabe said in the last one, I have like your claims and how I would attack that.
Mhm.
So I do have that down. Most police officers, and I can say this from like personal experience, I've been neighbors with multiple police officers. They tend to hang out near areas of higher crime. So we'll say like a gang related area or stuff where more bad stuff happens. We'll just say that. Unfortunately, it is more likely for people of color to live in those areas. And so that's where I was finding that that higher percentage of stops was coming from.
So basically it's poverty and not race is where you're
Yes.
coming from there. Okay, so again, I have that here. So that's actually perfect. So studies which control for poverty, so basically like take that out of the system. still find racial disparities in sentencing and policing. So just taking out the financial part of it, you still get that same statistic.
So you're saying that this stat like adjusts for poverty-stricken areas?
It just for poverty in general.
Poverty in general. Okay.
Yes.
So they're saying like they're like manipulating the stat that way.
Yeah, and I'd also like just to continue on that. Poverty itself is also just tied to systemic
that
racism.
I do agree with.
There's redlining. There's just in that general. So I guess that's a catalyst of that, I guess. But just also the fact that it takes away that statistic from it.
So you're saying that they have proven that like poverty has not been has not like affected it, or it's not like an accurate cause.
Well, I'm sure that the numbers are still different once you take away for poverty, but it still comes to the same conclusion. It might just not be as a severe level, but it still comes to that.
And is it the same, like they're being pulled over 10% or 20%?
20%.
More times, and like they're not finding anything.
Well, no, this is so this
a different thing.
This specific stat is on sentencing. So
could you just say it again? Sorry.
Yeah. So studies controlling for poverty still find racial disparities in sentencing and policing. So policing is included in that.
So like being arrested, pulled over. Sentencing is like sentencing, obviously.
Yeah, sentencing.
So I'd like to attack it from the sentencing area.
Mm-hmm.
So there's been studies on this too. Judges are more likely to pursue a higher sentence or more force it more strictly if there's been previous crimes committed or severity of crimes.
Sure.
So this is saying like for any crime in general, they're being sentenced more often or being sentenced for longer.
It's a lot of it has to do with plea bargains. They're not or plea deals. They're not given.
Okay.
So that's one. Longer sentences is one of them. That's basically what it's based off of.
Okay, so it's not based off of like, I don't really know. It's not based off like percentage of people facing time or stuff like that.
No, it's specifically, are you a person of color? And if you are a person of color, how much worse is your sentence going to be?
Okay.
If for the same crime.
Yeah. Yeah, again, criminal history, case severity plays into that. There's a higher rate of crime in poverty-stricken areas. I know that kind of dispels that, your adjustment. That's what I'm just going to call it. But yeah.
Control
yeah.
for it.
Yeah. Criminal history and case severity, not race, has played, because that's what many judges argue. And obviously, people who are sentencing for color and stuff like that are going to say that that's what they are. But most minority defendants are more likely to have prior convictions, and that's what I think is like, that's what those longer sentences are coming from. There obviously are some racist cops, racist judges in our system, and that is a system, that's a thing that has to be eradicated as much as it can. But that's what I'm saying is like minority defendants are more likely to have prior convictions, and that's what's leading to those longer sentences, more strictness on plea bargains, stuff like that.
Okay, so basically, it's are you specifically talking about crime rates, or are you talking, or if they've committed a crime in the past?
Kind of both.
Okay.
So like if they're a minority, African American, we'll use that as an example. They've committed a crime already. They're more likely to receive a stricter like regulations on their plea bargain or a longer sentence.
Okay.
Or more likely to be sentenced.
So let's go with defendants who have done a prior crime.
Mm-hmm.
That's still in the same. Their prior crime is still in the same legal system that they're getting tried for now. So there's still that racial disparity of, okay, this first crime could have happened, but that could have been a result of the same problems that we're attacking right now. So I think that's also a factor that you have to look into. It is.
So you're saying like that first crime could have been as a result of something like with systemic racism.
As a result, or it could have been toned down more. Mm-hmm. It could have been a lesser crime that was then made more serious.
Yeah. So again, I would say if you have already been accused of a crime, whether or not you had some aspect of systemic racism playing into that, why are you then again getting pulled over or being arrested for the same or similar thing. Like I know this is some of racism argument, like, but if you've already done something, like the odds, like,
Well, how do you know that you've done something? If we're
yeah, I know, but I'm saying if you have already been like received like a sentence or been accused of a crime or something like that, that whether or not you did commit, you would think you would be a lot more careful then, right, and not give anybody a reason to.
Sure, but now you're just a target by police. If police are going to be like, if police pull you over for going 10 over the speed limit, basically, and they pull you up on your record and see, oh, this guy has committed crimes before. Now they're going to be on higher alert. Now they're going to be on just like watching it more, and that could have led to the second crime. So that it's that punishment there that because of that first crime, which may or may not have actually been a result of systemic racism, plays into that.
So you're saying that since they received since the crime is on their record, whether or not it was justified, that's giving them a higher target, like they're more likely to have more accusations in the future?
Well, that's just for any, like, put yourself in the shoes of a police officer. If you have...
Well, yeah, obviously if you go and look up someone's record and you see that they were arrested for something in the past, armed robbery or like assault, murder, stuff like that, you're going to be more on alert.
Or not even that serious. It could just be anything. If you just say this person has committed a crime in the past, therefore they're more likely to be committing a crime now. Now I need to be more careful.
Well, that is just true, though. If someone commits a crime, they're more likely to commit crimes again.
Well, it's less that they are going to commit the crime again, and that's not really my point. My point is more that...
So you're saying that since they have that on their record, even if it's as a result of systemic racism, that they're more likely, like that's just like flashing the red lights to a police officer or something like that.
Yes, that's basically my point.
I'm just trying to think of how to approach it.
And we could attack this in a different way too. If we go on that, if a Black American gets pulled over, Black Americans are 3 times more likely to be killed by police than white Americans. And then again, these disparities persist after controlling for crime rates, local crime levels. So that's the neighborhood that they're in. Income, poverty, neighborhood demographics, that's a part of the same thing.
How many times more likely did you
3
say?
times, nearly 3 times. So that's the force there. So it's so in our scenario right now, you're police, you pulled over a Black American who has committed a crime in the past, supposedly. It's on their record. You're now going to be more on high alert. And now, look, there's 3 times more likely that this Black American is going to be it's killed by police rather than white Americans.
So you're saying that they're more likely to be killed because of the target that they have on their back, based on like their previous crimes and stuff like that.
I think there's other factors that play into it that I don't have the statistic for that, but that could be one of them. I think the main thing that should be flashing the red lights at us right now is that why are Black Americans 3 times? 3 times is like, you can't just say that that's like a little like coincidence. No. And it's like, it's 3 times more likely to be killed. It's like that's life and death right there. So it goes into a more standard when it's not just about our legal system. It's not just, oh, this person is going to get a ticket more often because they're Black. But now your life is at risk, and you're the people that are supposed to be protecting you and keeping you safe are the people that you have to be scared of.
I'm trying to think of like what plays into that. So you're saying like that's been controlled based like even after poverty, like their area that they're living in.
Yeah, and that's according to
and that's
Harvard
like
study.
That's like what's probably the most. Like that's especially what they're like what I'm trying to say is like police officers there's a higher concentration of police officers obviously in like the south
Different
side of Milwaukee
right.
than in like the burbs.
Right, and that's but. This is it's a Harvard study, and they controlled for neighborhood demographics and local crime levels. So controlled for what is the main race that lives in this neighborhood, and then also how much crime is committed in this neighborhood. If we want to, we can move on to why I think that. So I think right now
I'd like to see why.
Yeah. So I think right now I've proven that there is racism involved. I think just those 2 stats alone can say that there's something happening.
Okay.
I think now we can go into why it's systemic. So first, we can define what systemic is. Basically, it's built into its structures and policies. So racism is built into the legal system. It's a part of it. It's not like, oh, there's one guy who has this issue and he's just a racist like person. It's the system that's racist, not the people in the system. So we can just first point out that there's patterns across the whole system. Like this doesn't happen to one thing; it repeats nationally. Like the policing issues, bail, longer sentences, this all happens nationally. And yeah, so we can start there.
Okay. So first of all, the system itself is like the legal system itself is supposed to be colorblind. Constitution states that. Civil Rights Act, Supreme Court, judges and juries, they're all supposed to operate under the same pretenses. So, and officers and judges all go through training for that as well. So, inherent or not inherently, but in a perfect world, that everybody is like taught not to have racial disparities.
Right, and that goes back to it's just the people and not the system itself. But there are many laws that are considered neutral, or what you said, colorblind, but are applied unequally. So we can bring up stop and frisk. Stop and frisk policies disproportionately target Black and Latino men, even though the law itself doesn't mention race, which these stats are crazy. So 83% of those who were stopped were Black and Latino, even though they just make over half of the city's population, for example, in this study.
In what city or?
It's in this theoretical city, I guess, but I think it applies nationally too. Okay. Is the point. So white people made up less than 10% of the stops, despite being a third of the population. I'm pretty sure that's a national.
That's a national.
Yeah. So maybe I meant national on my notes, but I can check that, and then also I'll be fact checked too if that was wrong. But then also when searched and when stop and frisk, weapons or contraband were found more often on white individuals than on Black and Latino individuals. So that law disproportionately and systemically affects people of color.
I'm just trying to think of like where this applies, because obviously in countries or in states that are more conservative, there's going to be more white Americans. Like inherently more white people are conservative. That's like a fact. That's well known. And more conservatives follow the right to carry, and they carry weapons, and that's what that's saying there, that they're more likely to be found.
Well, this is specifically contraband. So
drugs.
So contra is an example, but illegal weapons, like if you're carrying a weapon legally, that's not included in the statistic.
You said 83% of stops were
Black or Latino.
And is that also controlled under that, like the city where they live? So like when I said more cops patrol areas of lower income and poverty-stricken areas, and more African Americans and Latino people live in those areas, is that controlled by the same?
Well, it's only half of the nation's. I'm going to say nations, but I'll be fact checked later if that's not true. Half of the nation's population. So that's a part of it. But also it's 83%. So even if you tame that stat down with controls for that, I'm not sure if this specific study did, but even if you did, that's a huge number. So it could still be more than half. And then also that goes back to white people made up less than 10% of the stops, despite them having the contraband and the illegal weapons. So,
so with that, obviously, like the police officer that's pulling them over doesn't know that they have a contraband or an illegal weapon.
Well, they need
well, yes, they do need proper cause, but maybe they see like an open beer bottle or something in the front seat or something like that. Just giving an example. But when they pull that person over, they're not just pulling them over for the suspicion that they have a weapon or something like that. They're not pulling them because that's.
But they're stop and frisking them because they think that they have something. We're specifically talking about the stop and frisk. So they're.
I'm not familiar stop and frisk. So you're pulled over and you're asked to step out of the car, or.
Well, they have reasonable doubt to pull somebody over, so that could be anything. But then you're allowed to have the person step out and frisk them down and search for contraband. So the reason that, hopefully the reason that they would be doing that is because they have reasonable suspicion that they have something illegal.
I'm just kind of confused. So they're being stopped for a variety of issues, suspicion, like there's some tail light out, or going over the speed limit, not
Which
having,
also taillights, and you can't fix the taillights,
Yeah.
so that goes back. That's just another point. That's a side tangent. But anyways, like they're
so they're being pulled over for any variety of reasons, and then they're being asked to step out of the car to be frisked.
they have to.
Probable cause.
If under my understanding of it, they have to have reasonable suspicion, but that reasonable suspicion could be
Unreasonable. Yeah.
unreasonable.
They're just saying, yeah, step out of the car. Okay.
Uh-huh.
I get what you're saying now. There are there's also systems to like help people who are being stopped illegally. Body cam footage. I have it down right here and I just lost it. Dang it! I was literally just looking at this. Shoot.
No, I have a lot too. I had to go through it. So.
Yeah, body cams, oversight boards, stuff like that. They review a bunch. Like body cam footage, obviously not all of it gets watched, but when someone is stopped, and frisked illegally, the body cam that's on the officer, they're gonna the person watching that's gonna see. Well, they just pulled this person out of here for no reason.
Who's the person watching that?
The police.
The legal system. The legal system that we're therefore
So-
arguing has systemic racism built into it.
So, see, this is why I'm confused by the stat. Is the person that's being stopped and frisked facing time or
It depends on what they
or
find.
seeing the court? Yeah, obviously. But are they, when they find something, are they facing time?
They could be. If they found illegal weapons in there.
Which mic is it? This one. 4. Thank you. Just to interject, we have about 2 minutes left.
Okay.
So,
I think we're getting kind of tight on this, so I think we should maybe pivot. It's up to you, though.
I think that my main point is that. Well, could you somehow show me how I think.
Where that large gap is coming from.
Well, where that's coming from, if it's not systemic racism.
Yeah. I don't really see where it is coming from. 83, that disparity is way too large to have anything to do with speed rates or do something like that. But there's
So you can acknowledge
yeah,
there's something.
There is something, obviously. And there's obviously officers that are corrupt or are racist and stuff like that, and that is a problem. But there's also systems in place to protect these people from these crimes. So let's just say that this person gets stopped and frisked and they find something, then that person is facing time or something like that. They can use that body cam footage to see if that officer did have probable cause. Obviously, probable cause is a very debated topic.
Especially
What is considered probable cause? What do you need to have that? But there's systems that can protect those people.
And those systems, I'm arguing, are racist. I think that built into those systems that you go back to the legal system where you take that body cam footage or any other evidence and you submit it to the courts. I'm saying that the systemically built within the court, those processes have racial biases.
Okay.
Okay. I wanna if I was to close on something, I don't know how much, I think we have a minute left.
30.
Okay, perfect. So I just want to close on this.
Yeah.
So if our justice system were truly equal, race obviously wouldn't predict who gets stopped, who gets sentenced, and who gets imprisoned. But the data does prove that happens. Race is a factor. And that just, in my conclusion, proves that systemic racism is built into it.
Yeah. Okay.
all right, and that's our time. And that's our time. Do you have anything you'd like to finish with to close off the debate?
I think I said everything I would have said anyways. But yeah, thank you guys for having me on. I think it's really important for people our age to have these conversations, these tough, hard-hitting conversations that we have, not only to open our own minds, but to speak up for ourselves. The laws that are being put in place and changed now are going to affect us in the future too, and we are the future politicians of America, so we should have these conversations.
Great.
But yeah,
Thank you so much for the discussion.
Yes, sir.
great time.
Great time.
All right, Ronnie, thank you so much for helping us kick off season 2 of the podcast. We look forward in future episodes to more debates like this one. It's going to be fun to see where the season shakes out and where we can go from here. This was a long-awaited debate with you. I think I've wanted to have you on for a hot minute. One of my really good friends, so I think it was fun to have you on.
It was a great time, yeah.
For sure, guys. You all can continue to support Take Two on our socials. We post all of our content on YouTube. You can also follow our Spotify for full episodes. We post short-form content on Instagram. We post podcast announcements on there as well. You can do guest requests on Instagram. The handle is at Take2PJ. That's at Take2PJ. And that is all we have today for Take Two. We'll see you next week, Tuesday.